In Season 1 and 2 of this trauma training, we've looked at various definitions of trauma, understanding it as both the traumatic event and reactions to that event, sometimes called trauma reactions. We learnt the difference between one-off type 1 traumas and long-term type 2 or complex traumas. We then explored the diversity and difference there is in both the kinds of trauma people may experience and the ways people might react to trauma. Two different kinds of reactions people might have are unresolved trauma and resolved trauma. Resolved trauma is where people make sense of and process trauma in healthy, positive ways that have no long-term effect on their future well-being. Some people even talk about post-traumatic growth, where people report developing new knowledge and skills through overcoming a traumatic event. However, we learned some people experience unresolved trauma, where they get stuck in the process in their trauma reaction and suffer long-term ongoing harm to their emotional well-being and their physical well-being as well. So we've learned that trauma reactions can show up in 4 main areas. That's areas of our beliefs or patterns of thinking about ourself, others, the world and our future. The second area is our emotional states. So emotional states of fear, anger, low mood, guilt and shame. The third area is physically. Trauma reactions can show up in our body and biology. We talked about somatization, about things coming physically out in the body, or acted out physically in our behaviour, in health-harming habits such as self-harming, overworking, or excessive alcohol and drug use, and other types of repetitive excess which develop understandably to manage difficult emotional states. They work in the short term as a way to survive, but in the long term they tend to lead to more problems. So trauma reactions can also show up in that fourth area, which was relationships, especially how we relate to others in interpersonal power relationships and the degree to which we can trust other people. We've also learnt about vicarious re-traumatization and the vicious trauma of vicious re-traumatizing circle and the virtuous circle of healing and hope, and the value of a positive relationship can make to turn a vicious circle around into a virtuous circle of healing and hope. This training has not just been about passively learning about trauma, but it also covers skillful ways we can actively respond to people who are being affected by trauma in helpful ways. There are things we can do which practically help people to heal and recover, such as be validating, motivating, build motivation, and collaborate with people, share power, particularly around collaborative problem solving. We can also increase people's safety and their empowerment, their choices, and our trustworthiness, or people's ability to trust us by being reliable and consistent in what we do, not over-promising. We've also learnt about how people can be triggered into flashback into emotional states that feel like the original trauma, and how grounding techniques where we mindfully notice the sights and the sounds and the smells around us in the present can help to calm us and ground us when someone's triggered. We saw how important it is for us to be able to help people access a wide range of services in the community, because connecting with community support can help people to heal. We've explored the importance of increasing people's safety to protect them from further harm, and how principles of psychological first aid can help, such as being calm ourselves, increasing their safety, increasing people's sense of personal agency and collective agency, and being involved in the process of being helped, and communicating hope and connecting people with others. We've seen how to reflect on and adapt our own practice to reduce re-traumatizing practices in terms of increasing people's safety, empowerment, choice, collaboration, and trust in us in the way that we offer to help people. And we've looked at the impact of secondary or vicarious trauma and seen the importance of self-care and having a well-supported workforce to help people process the emotional wear and tear on the front line and reduce the likelihood of burnout and compassion fatigue. So putting this knowledge And these skills that we've covered in season 1 and 2 into practice a little bit more each day can help shift the culture and practice of our organisations to become more trauma informed and help us to deliver a better service to those we want to get alongside and be helpful towards.